Hi, this video simplifies the causes of pericarditis with a simple mnemonic pericardiums. I hope this would be useful when organizing your ideas and thoughts pertaining to this subject. So sit back and let's get started. Pharmacological agents such as procainamide, hydralazine, penicillin, tetracycline derivatives, isoniazid, and amiodarone, among many other agents, may lead to the development of pericarditis. The mechanism through which the insult results in pericarditis includes a drug-induced lupus-like syndrome that causes inflammation of the serous pericardial membrane, a hypersensitive reaction with eosinophils, and a direct cardiotoxicity may also lead to pericardial inflammation. Endocrine. In hypothyroidism, it is believed that there is an increased vascular permeability that causes albumins to leak into the pericardial space, increasing the oncotic pressure of this compartment. In addition, the lymphatic drainage capacity of the pericardial space is limited, creating a conducive environment for effusion and further inflammation. So radiation may directly damage the endothelial cells, or they may induce the inflammatory cells that will lead to release of pro-inflammatory as well as prothrombotic molecules. Example of these include interleukin 4 and 13, transforming growth factor beta. The net result is that this is going to lead to a microvasculature dysfunction, that is the endothelial dysfunction. And that means that there is going to be vascular permeability and accumulation of fibrin exudates that can cause pericarditis as well as cardiac tamponade. On the other hand, these pro-inflammatory mediators can also lead to proliferation of fibroblasts. This can lead to heart failure, constrictive pericarditis, and conductive problems such as arrhythmias. Viral infections is the most common form of pericarditis. Among such viruses includes Coxsackie, influenza, Epstein-Barr virus, mumps, herpes, adenovirus, parvovirus, and HIV. Most idiopathic pericarditis are often attributed to viral causes. Bacterial pericarditis from Streptococcus pneumonia, Staphylococcus aureus, or gram-negative bacilli are less common. Other etiologic factors may include a fungal infection. So an acute inflammatory response arises. There is a polymorphic nuclear leukocytes, cytotoxic T and B cell mediated response that enhances the release of inflammatory mediators such as interleukin 6, 8, TNF alpha, and gamma interferons that predisposes the pericardium to exudates that may be in the form of a serous, fibrinous, purulent, or hemorrhagic exudates. Caseous inflammations are always TB unless proven otherwise. Tuberculosis spreads through the lymphatic route, leads to fibrin deposition, caseous granuloma, a serous sanguinous effusion that may lead to constrictive pericarditis in the future. Advanced cancers that affect the lungs, breast, esophagus, mesothelioma, leukemia, and lymphoma through a direct extension or metastasis via the lymphatics or hematogenic spread may predispose the pericardium to inflammation. Moreover, pericarditis may occur from the chemotherapeutic toxicity and radiation used in the treatment of cancers. Cancer itself leads to immunosuppression, making such patients susceptible to opportunistic infections. Cancer may grow and obstruct lymphatic vessels that creates a conducive environment for the invasion of microorganisms. Autoimmune disorders, commonly lupus, but also rheumatoid arthritis, systemic sclerosis, vasculitis, sarcoidosis, may affect the pericardium. The production of antibodies and the formation of immune complexes may deposit as well as activate complements. This leads to cytokine formation and an inflammatory response. Dressless syndrome, also known as post-myocardial infarction syndrome, is thought to be an autoimmune reaction that results in the inflammation of the pericardium. There is release of anti-myocardial antibodies to the damaged cardiac antigens that occurs after sustaining a myocardial infarction or after an open heart surgery. This usually occurs within 1 to 3 weeks after the event or procedure, but may also occur later than that. Idiopathic pericarditis is when the cause cannot be found. Usually, such pericarditis are also attributed to viruses and treated as such. Surgical, such as post-pericardiotomy, iatrogenic introduction of infection into the pericardial space, adhesions, and failure to drain bloody effusions may lead to pericarditis. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.